Bleb needling is capable of restoring function to glaucoma filtering blebs that have failed clinically. A small gauge needle is usually used for such bleb revision. However, movement of the needle is sometimes restricted by strong resistance and the conjunctiva, with the result that incision of the underlying episcleral scarring is inefficient, because only the apex of the needle is able to act. A crescent knife is used for cataract surgery to incise hard tissue such as the sclera, but such a knife is too wide to manipulate and the conjunctiva bears a small entry site and is too short. We have now developed an extra fine crescent knife for bleb revision. Instruments currently available for bleb revision include a small gauge needle, a needling cannula, and a Nakano lamella separator. The advantages of a small gauge needle include a low price, variable bending angle, and small entry site into the conjunctiva. The disadvantages of the needle is that its manipulation is often inefficient, with only the apex being able to act because of strong resistance. The needling cannula and Nakano lamella separator are relatively new and excellent instruments for bleb revision. However, both are expensive. The needling cannula also becomes dull with use, and there is a risk that the entry site of the Nakano lamella separator into the conjunctiva may become expanded. It is sometimes difficult with a small gauge needle to enter the thick bleb wall and to puncture and incise the fibrous episcleral tissue. Needling may thus result only in expansion of the cyst, not their incision. A crescent knife is used for cataract surgery to incise relatively hard tissue. We sometimes use this knife to incise adhesive connective tissue in the conjunctiva or the sclera. However, this knife is too wide to manipulate under the conjunctiva by the small entry site, and the bend is positioned so close to the apex that the working area is small. We have therefore developed an extra fine crescent knife for bleb revision, the Bleb knife. The Bleb knife, which is based on the crescent knife for cataract surgery, has a maximal width of 1 mm and bends at a position 10 mm from the apex. We have used this knife for bleb revision as an alternative needle. The width of the Bleb knife is less than half that of a crescent knife used for cataract surgery. The bend angle of the Bleb knife is more obtuse than that of the knife used for cataract surgery. And as I just mentioned, the bend point of the Bleb knife is 10 mm from the apex. You can see here the fineness of the Bleb knife compared with needles or 20 gauge MVR knife. After subconjunctival injection of 2% lidocaine, we attempt to Bleb revision with a 27 gauge needle. As you can see, it was difficult to insert the needle into the thick Bleb wall. You can also see that the eye moves in accordance with the movement of the needle. This highlights that needling is inefficient for incision of the connective tissue. We next attempt to insert the Bleb knife into the conjunctiva of the same patient. A conjunctival incision was not necessary before use of the Bleb knife. The Bleb knife was inserted into the subconjunctival space and advanced smoothly, even in portions where adhesion was pronounced. Subconjunctival manipulation of the Bleb knife was much less restricted than that of a small gauge needle. The knife entry site was usually small and fine. Bleb leakage was rare, but conjunctival suture was required in a few cases. We also applied the Bleb knife to severe subconjunctival scarring. We were able to advance the knife smoothly and safely under the conjunctiva. It proved relatively easy to detach the severe scar tissue from the sclera. The Bleb knife thus has various advantages for Bleb revision. It is easy to manipulate under the conjunctiva. Resistance to its manipulation is low, likely as a result of the sharp and fine blade and the round shape of the apex. There is no need for pre-incision of the conjunctiva. Bleb leakage is rare. Finally, we have found that the Bleb knife is also applicable to cataract surgery. Thank you for your attention.